The Substance Abuse Advisory Council Secretariat, SACS, recently hosted a discussion session with representatives from various partnering agencies to deliberate the results of a study. The study undertaken was a 3-month exercise which entailed a focus group with youth aged 13 to 17 years old around the island, providing insight into the current risk behaviors and exposures as it pertains to substance use or any behavior issues that may put youth at risk for using substances. The session provided an opportunity to discuss the findings of the study and to outline an action plan for next steps in addressing the issue of substance use among youth. Coordinator of the Substance Abuse Advisory Council Secretariat, Natasha Lloyd Felix, thanked the OECS CCAD Drug Control Commission for the support in conducting the study and said this will assist the unit in the shaping of its programs.
CCAD provided us with the support to engage a local consultant who went through the communities, met with young people in the focus group format, and had discussions with them. Got their views on what they knew to be happening, either through their personal experiences or that of their peers, as it pertains to substance use. What are the substances being used? Especially what are the new substances? And that we found is happening is that we have substances that are new to us in St. Lucia in terms of importation, as well as in terms of mixing of legal substances to create something that gives a high for youth.
Lloyd Felix also emphasized on the need to provide their stakeholders with first-hand information about the youth, which will assist them in tailoring initiatives or programs centered around substance use prevention.
This was of importance to us simply because we know youth in that age group tend to have a very low risk perception. They're adventurous, they would try new things, and they also have very strong peer influence and peer relationships. And we wanted to hear precisely what was happening with them, what concerns them, what they thought were solutions or mitigating factors that could help reduce their risk. And today's exercise is really to share these findings with our stakeholders, partner agencies who work with young people, with organizations who work with youth representatives as well, so that we can now look at what's the way forward. What can we put to use? What's the application of this information? How we can strengthen what we do and how we can create new interventions which meet the needs of the youth based on the information they shared with us.
Customs Inspector Darren Solomon welcomed the opportunity to be part of the discussion and highlighted the importance of the information to his department.
For me, it was a rude awakening because it basically highlighted the easy accessibility of both illicit and illicit substances on island. So it's a very, very interesting study, and I think it is one that will be used in the future to create certain interventions in terms of dealing with this issue. For us, we need to perhaps focus on importations. So the substances that are being imported, and especially, for example, I'm a member of the early warning system. So certain drugs that may be new on the market, it's possible that these drugs, because of the inability to detect those drugs, we will have to focus on their importation on island.
The discussion involved the participation of the Royal St. Lucia Police Force, Ministry of Education, Ministry of Social Transformation, Probation Services, Boys Training Center, and organizations working with youth in school, out of school, and vulnerable. Reporting from the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Fernal Neptune.